Hello to all of our viewers. This is Dr. McGill, and today we will talk about sickle cell. Sickle cell is a disease that is localized in the African gene, the genome. And so what that means is if you have sickle cell, or if you know someone who has it, primarily they are black or the African descent, and their parents, the mom and the dad, both had the gene, and the child ended up with sickle cell from that. Now, this disease is pretty chronic. We have made great strides in our medical advantages where you can live a quality life with the disease, and as long as you take precautionary measures. Because what happens in sickle cell is you have vessels that are shaped like this, so they have a circle, and your cells are generally a circle shape. But if you have sickle cell, they look like an S. So instead of trying to get a circle cell into a circle vessel, you're now getting a sickle-shaped vessel into a circle vessel. A sickle-shaped cell. Try to say that fast, it's very confusing. A sickle-shaped cell into a circle vessel. And so what happens is blood kind of backs up, and you're not able to go ahead and perfuse the rest of your body. This is why patients who have sickle cell always categorize themselves as having pain. They have pain in their legs primarily because they can't get the blood that the heart is pumping to the rest of their bodies in the lower part. So when you have sickle cell, it is very pertinent that you follow these patient education tips. The first tip I will tell you is to stay hydrated. You should drink at least 4 of the 16-ounce bottles of water a day, or at least 8 glasses, however you want to divide those up. And the reason that I say stay hydrated is because if you're not hydrated, those round vessels go flat. So now you have sickle-shaped cells that are trying to get through a flat vessel instead of it being a circle shape. That can cause problems. That can cause you to go into what we call an exacerbation. Exacerbation means that you were fine at home with your disease, and then all of a sudden the disease got worse and you had to go into the hospital. So what we want you to do is to take care of yourself where exacerbations occur not at all or less and less. So the first tip is to stay hydrated. Every day, get on a calendar how much of water you're going to drink per day. Yes, you get water from juices and drinks and the food that you eat, but it is not the same quality as drinking pure water. The second tip is to make sure you take your medications. Probably the physician has put you on a folic acid, which causes the red blood cells to create, and you're probably on an iron tablet, which causes the life of the red blood cell to stay the full 120 days that it's supposed to, and more than likely you're on an ibuprofen. That's for pain, and that's also to help with the inflammation that can cause with that pain. You need to make sure you take your medication every day as prescribed. So it is important for you to remember that so that your blood count can stay up. All right? Then don't get too cold. Why not get too cold? Because if you get too cold, then your vessels that are round are going to shrink. We still have a problem with the passageway there. So if you get too cold, your vessels will shrink, and then we can't get the blood cells through. If you get too hot, then you're not going to be able to stay hydrated because you'll sweat. So it's a double conundrum there. You have to make sure that you stay right there in the middle. Not too hot and definitely not too cold. Okay? Avoid traveling to climates that are high climates like Colorado or places with mountains and all of these, because the more altitude, the higher the altitude you go up, the more apt it is for your cells to sickle and your vessels to constrict or shrink, and you not to be able to perfuse your body. And if we don't have perfusion, that means blood going to all distal prominences, then we won't have good quality. You can't breathe, you'll be in pain, and then you'll have an exacerbation, what we talked about earlier. The last comment, the last patient education tip is to keep your follow-up appointments. It is important that your lab work is monitored so they know your blood count. They can look and see through the microscope if your cells are indeed sickling, and if there's anything that we can do proactively rather than reactive. Proactive medicine means that we're doing something to prevent complications. Reactive medicine means we're doing something because we have a complication. It's always better to be proactive in our responses. So if you would take these tips and apply them to your therapeutic regimen, you will see less and less exacerbations in your sickle cell disease. I hope that they are valuable to you. As always, if you have any questions, please comment below.